patient do this, or I do it. I'm going to have you bring your arm up and just let it rest on top of your head, like this. Okay? And I can hold it there and see if there's a change in symptoms. Okay? Now, I've got down here Backety sign, which is a positive test, indicates he gets into this position and it reduces his radicular symptoms. Okay? There's a compression at the nerve root. So all I'm doing by putting him up in this position is I'm taking tension off the nerve root. Okay? So that reduces pressure on the nerve root. If it provokes symptoms, McGee suggests that you may look to the interscalar triangle for problems, kind of thoracic outlet. Shoulder girdle depression. I can do this in two ways, and I'm going to do it in 2 steps. The first step is, if he has symptoms on the right, is I'm going to depress his shoulder girdle. Feel any symptoms? No change in what you feel in your arm? And then I'm going to passively side bend him. Okay, so I start with one component and then the other. Again, we're looking at any kind of nerve root compression, so provocation of symptoms may indicate nerve root compression or simply nerve root irritation. Okay? All right, can you come over here and have a seat? So those are pretty straightforward, simple tests, and I'm just starting to test and see if there's any stretch to the nerve root. The last one is called the Adsons maneuver. You guys remember that from the shoulder girdle? Okay? So all you did was feel the pulse. The arm came back. Turn and look towards me. Okay? Take a deep breath in. Hold it. And what's a positive test without looking? Pulse goes away. And reproduction of symptoms. Okay. All right, how many of you guys, when you did that test, had a decrease in pulse? Anybody in here remember? Nobody? It's not that uncommon to have, in a normal population, a reduction in pulse. So add on there that it needs to reproduce or provoke their symptoms.